Hi, I'm Erin Alberty. Welcome to Trib Talk. I am a health reporter with the Salt Lake Tribune. I am here with my coworker, Nate Carlisle, and Arlyssa Becenti. If you guys want to say who you guys are, then everyone can know and start asking questions as they have them.
I'm Nate Carlisle, reporter at the Salt Lake Tribune.
Yeah, it's Arlyssa Becenti with the Navajo Times.
All right, so we're here to answer your questions about the state of coronavirus in Utah and talk about some of the hot spots that have popped up over the course of this pandemic. I think one of which that has gotten a lot of national attention is at Navajo Nation. So maybe we can start with Arlyssa actually, and maybe you can tell us a bit about kind of what the status of things is there. It looks like things have been kind of mercifully and slowing down a little bit compared to how things were going earlier, at least looking at San Juan County numbers as we see them here. I know there's a lot more to the nation than that though. So Arlyssa, can you tell us a little bit about that?
Well, when it comes to coronavirus and the numbers and the testing and how much we have so far of cases, right now, last night, we've had approximately 7,045 cases. And that was about a 55 increase from the previous night. And the reason why that's a big deal is because for over a week now, we haven't surpassed 90 cases, which is, I don't want to say it's a good thing, but it's at least promising that the numbers are flattening and that the mandates, the public health mandates that have been passed by the Navajo Department of Health and epidemiology, I can't pronounce that, the Epi Center here on Navajo Nation has had great impact on us. So the mask wearing, the social distancing, the curfews, the lockdowns, we went back to our lockdowns this past weekend for the next 2 weeks, the 57-hour weekend lockdowns. And we do see a positive impact, whereas cities and states, we've seen their numbers surge, especially in Maricopa County. So what we're trying to do, or what our leaders are trying to do, is continue to have these mandates, but as well as telling our citizens, please don't travel, stay home. I know it's summer, but don't travel off the Navajo Nation, because you could bring this bug back and we would have to start all over again. And so the numbers are going down, and although not good, but still it's a promising look at how low it is compared to what it was this time last month.
That's really good to hear. I know that in a lot of Utah, we're kind of struggling to see a way forward as our numbers just climb and climb and climb. I mean, have you noticed, has there just been a lot of discipline in the community to achieve this? I mean, because it was pretty rough there for a while, and it seems like, that's really good news to hear.
I don't know if it's discipline. It's just something that we know we have to do. The priority that we have is taking care of our elders. I think I tweeted a couple of weeks ago that the majority of, at the time it was about 311 deaths, a majority of that was people that were 60 and over. So our elders are suffering from this more than anyone. And so I think just by that fear alone of losing our elders, of seeing them suffer, we just take it on as like, okay, this is our responsibility for our elders. We need to respect our elders, and so we will wear masks, we will show social distance, and we will adhere to all the other public mandates. So I don't hear of any complaints. You see these crazy TikToks or videos on social media of people just not wanting to wear masks, and to me that's just crazy to see that nobody really cares enough to keep a mask on just for the safety of other people around them. Mm-hmm. And here you don't see that. I went off the res, I think back in May. We've had this mask wearing mandate since April. So when I went off the res and in May, and then again in June on I-40, I saw some tourists, some people passing by, stopping at a Navajo Nation owned gas station and just questioning why they have to wear a mask inside the store.
Yeah.
So yeah, so that's it's just our responsibility, we feel.
Yeah, I know that people have said, like last week, the legislature, they had a committee that heard from the health department about the situation here, and the director of the acting director of the health department, Jeff Burton, said something to the effect of, "Look, the second you leave Salt Lake City, you'll be really shocked to see how few people are using masks."
Mm-hmm.
And I'm like, well, I don't know if I'm seeing a ton of people using masks in Salt Lake City, but I guess it's better here, in terms of mask use than it is, in other parts of Utah. But I guess once you get back to Navajo, then you start to see maybe a big commitment to mask
Yeah,
wearing.
you really do. My sisters live in Mesa, Arizona, and they get stared at constantly when they wear their mask in Arizona or in Mesa. And then when they come up here, they're just part of the crowd because everybody's wearing a mask.
Wow. Well, yeah, is anybody doing anything cool with their masks? I've been kind of disappointed that people haven't been doing more like art with their masks up here. I really expected that.
I've seen some pretty cool designs. I'm in and out of this newsroom. We're not mandated to stay here if we don't feel safe, but I have coworkers that are great. One left me a mask with like little flower designs on there, and that was really cool. And I've seen people wear, I wish I had a scarf, but they're called Sani scarves, and they make them into masks too. So those are really colorful and really pretty.
Well, that's cool. Well, I'm glad to hear that people are, have kind of managed to turn this around for themselves, and just, like you said, for the elders. Obviously, everywhere you go and everywhere you look, every population that this has come through, it's just hit seniors really, really hard.
Yeah.
Yeah. So I think looking at another hotspot that we've had here in Utah, Nate, I know that you have been doing a lot of coverage at the situation at the meatpacking plant up in the Bear River district. Can you tell us a bit about what happened there? What's the situation now, and how things have changed?
Yeah, so the Hiram, actually they called the JBS beef plant in Hiram, was a real hot spot. End of May, start of June. They know of 287 employees there who tested positive. That doesn't count the employees who might have sought their own testing elsewhere. That's had a ripple effect through the county, not just from the people that, the employees that tested positive, but then of course they infected people in their households. Also, some of the employees who didn't even test positive have been afraid to go back to work. They might be in a high risk category, or they might live with someone in a high risk category. And so now they're out of work. And the social safety net up there in Cache County is trying to compensate. Churches have been trying to deliver meals and toiletries to the households. A lot of probably most of the employees at the plant are immigrants or refugees, and there's some charities specific to them that have been trying to help out as well. To emphasize something you said about mask wearing, I went up there last week to report on this story, and my way home, I stopped at a sandwich shop in Brigham City, and I counted 16 people in there, including employees who were not wearing masks. And it was me and one other person wearing masks. So yeah, even in like parts of rural Utah that have an outbreak, I mean, Brigham City is what, 30 miles from Logan, maybe. Message still isn't getting through that masks are important.
Yeah, it does not seem to be getting through, and I'm not sure what it would take to make people have an interest in mask wearing in the communities where it's just not very common. I mean, Arlyssa, when you talk about, was it your sister getting stared at in Mesa?
Yeah.
I mean, like staring at it just seems like such a common thing around here, and but well, you wouldn't stare at somebody for wearing a mask, but I think that the fact that people have lost their jobs as a result of being afraid to go in, I think is kind of telling. I know we have on our website right now a story about a memo that was a report that was sent out by our state epidemiologist, Angela Dunn, to a number of state and local health leaders. And one of the things that they stress, because they're projecting just a really bad situation in Utah here, saying that, you know, hospitals are saying that they expect to be full in the next 4 to 8 weeks. IHC is reporting they will run out of, Intermountain that is, will run out of conventional ICU capacity in some hospitals in July, which starts in a week. You know, July is right around the corner. It's not, summer is moving faster, I think, than I would have guessed. But you know, our numbers keep going up and up and up. And in this memo, one of the things that she addresses is workplace spread, saying that we really need to work with employers to ensure their employees have the ability to quarantine and isolate when needed through paid sick leave and worker protections. And so, Nate, you're kind of seeing that that protection is not afforded these meatpacking workers.
Well, it sounds like the company made some efforts. You know, they put up kind of plexiglass between stations, like you kind of see at the grocery stores now. A couple, you know, they tried to kind of separate the shifts out a little bit, so it wasn't so many people working at one time. But you also have employees that have said that they had symptoms and were told to come to work anyway, that they didn't have enough labor, and, you know, the cows had to be butchered. So it's kind of a contradiction there. But Erin, I was just looking at this Utah Department of Health website. They've got data on where people are getting infected generally, and workplaces are far and away the most common place for people to get infected. I mean, it's workplaces, and then it's not even really close. I think the next biggest category is household infections. So one interpretation of that would be you get infected at work, you go home and you infect your spouse or your kids or whoever you live with. So that's probably a major reason why that memo talks about working with employers to better to try to eliminate spread at workplaces. The other component of here is that you remember one of the big centerpieces of Utah reopening, or largely reopening a few weeks ago, or at least going down to yellow from orange, was that we supposedly had great contact tracing, and which is where, okay, you're infected, so someone from the Utah Department of Health calls you and asks who you've been in touch with and that sort of thing. Now we're hearing that the contact tracers are being overwhelmed. So we don't have the capacity to investigate these infections that we once did.
I know in this memo, one of the things that Dr. Dunn says that, you know, back when we were at red and orange, every case was just not a ton of work for contact tracers, because they would have to contact like 5 people. That's all the people that anybody had in touch with when we was under restrictions and everybody was trying really hard to stay home. Now each case takes on average like 20 contacts, which is a lot of people to call. And at that point, you know, who knows who's the source and who knows who is the recipient of the infection. You know, I mean, I've been thinking just in this week alone, if I were, or if anybody in my family was to come up positive, we really wouldn't know. It would be hard to figure out where we got it from, I think. But I'm wondering, Arlyssa, at Navajo, are there employee protections for people so that they don't have to, you know, go into work? I don't even know, you know, what are some of the major employers there for the folks living there?
Okay, so the tribe, the government is obviously the major employer, and they've been shut down. They'll be shut down until July 5th. Every 3 weeks, every 3 weeks they take a look at it to see whether or not they should be opening. And since March 13th, when they close, I believe it's that day, you know, every 3 weeks they just continuously say that, you know, we're going to keep this closed. We need to make sure that our employees are safe. We need the numbers to come down. So with this CARES Act that that Council and President Nez have been, you know, going back and forth with, a lot of what they're wanting too is to put some money, a lot of money, into cleaning these our tribal government facilities and making sure that, you know, our employees are feeling safe, because there's been talk of how some employees don't want to come back to work because they don't feel safe at all, and they're still getting a paycheck. And it's been said time by leaders okay, you don't want to come back to work. We get it. You're scared. But, we are finding that we can continue on with this government without you in place there, you working. So government reform also is something that I think will come out of this whole COVID, because they're seeing what can happen with a very small amount of people working and processing papers and everything like that, and paychecks and working for the government. So I think that will come out later on. But right now, when it comes to opening up the government, they're trying to get those funds from the CARES Act to pay for disinfected and everything like that. Our office here, we've had, I think, 2 or 3 employees in the back room, in the press room, who tested positive. And over the weekend, it was cleaned and everything like that. But then still, through CDC guidelines, our publisher decided that, for 2 weeks, we're going to have to close. Mm-hmm. So that means we're not going to be able to print our paper for at least a week or 2.
Oh, geez. Oh, I'm sorry.
Yes.
Mm-hmm. So we have a question here from Facebook from a David. Why aren't we shutting stuff down due to all the high case numbers? Well, the decision, and I guess either of you want to weigh in on this, but I mean, the decision to shut down, and this is something, well, shut down, that what we have in Utah, as I think almost everyone knows, is this color-coded system where it is the top level of restriction. Orange is pretty restricted, and then yellow is far less restricted, and then we've got green, which a lot of the rural counties are at now, which is new normal. Basically, the risk is seen as gone. The decision to change any place's color is the governor's decision, and the health department, well, in this memo that we obtained yesterday, the state epidemiologist says if we aren't down to 200 cases a day as a rolling average by the beginning of July, that we should go back to orange. And she also calls for a mask mandate, a face covering mandate. And so that's what the health officials want, but it does come down to, what the governor chooses, what Gary Herbert chooses. I don't know if you guys want to add to that, how high do the numbers have to get before things shut down again? Is there a point at which businesses voluntarily shut down because it's not worth it to put everyone involved at risk?
Well, a couple things. First, I mean, all the inferences I get from the governor is that the reason we don't close things down is totally about the economy. I mean, last night his tweet didn't say, I don't think we need to go to orange or red yet. It said, I will not shut down the economy again. Mm-hmm. So I think that's his entire mindset. As for whether businesses are going to have to close anyway, I'm sure some of them will. I mean, we saw some of that the first time around, whether it was a store or manufacturing plant or something like that, making their own decision to go ahead and close restaurants. Some decided on their own in Utah that they were going to close because they had an infection or the risk of infection was too high. And I'm certain we're going to have to see some of that again. There's just no way to avoid that with the numbers being what they are.
Yeah, go ahead. I'm sorry, Arlyssa.
Okay. Well, mostly, again, the Navajo Nation is closed. The government, the parks and the recs, those are closed. Everything is closed until July 5th. We have some fast food joints, some restaurants, but those are all drive-through. When it comes to the Navajo Times, it's limited use. We're not all allowed to be in here. And our casinos have decided to close down, continue to close down, especially since even though Arizona casinos are open, I just read that they would have to close down as well, especially with all their safety protocols that they put in place. But yeah, everything here just seems to be continuously closed. And I feel like our leaders are fine with it because they really want those numbers down. They want to open, obviously, and especially now since it's our budget season, our general funds budget season, and especially with our leaders, going about with the closing of NGS, Canton Mine, and seeing what our budget will look like in 2021, it's kind of difficult to be closed, especially when it comes to oil and gas, you know, just all these facets that come together, and how this pandemic is just putting everything to a halt. But our leaders, I feel like from their tone, they're like, okay, yeah, we know this is kind of bad situation economically, but we're going to close. We're going to keep staying closed until we see those numbers drop.
Now, I think go ahead, I'm sorry, Nate.
Well, I had a question for Arlyssa is, have your leaders articulated to what extent what happens in Utah, Arizona, and New Mexico, elsewhere in those 3 states, I mean, impacts the Navajo Nation? I mean, for example, are your leaders rooting for Utah to go back to orange or red?
No, actually, they're a little disappointed that the states and the cities around us are opening, and they're because they think if those open, then more people will branch out and they'll go out, or tourists will continue to come in, and just the whole spread of COVID. That's why our leaders are saying, to visitors, please don't come this way, don't travel through, just keep going, because they're afraid that they would bring in COVID or we would infect them, and as well as community infection happening. If you go off the reservation, you might bring it back, you don't know. So that's why our gas stations, this is good for visitors who are wanting to come through Navajo during curfew. Our curfew is from 8 p.m. to 5 a.m. Okay. Gas stations are closed. All the stores are closed, especially the gas pumps. So just in case anyone comes wanting to pump gas on the Navajo Nation, the gas pumps will be closed around that time. Wow. And for our 57-hour lockdown as well, all those are closed.
Wow. That's just so much more than restrictions than we're seeing around here, for sure. I know that one of the things that health officials have said, and they discussed this in that legislative committee last week, is the concern that if we don't get these numbers under control now, like in the next couple of weeks, September's approaching, and that means flu season's approaching, and there's a big worry here that and this is what's happened often in historic epidemics, is it comes, settles down a little bit, and then the fall comes and it just goes insane again. So it's and I know that one of the legislators said was like, I keep hearing, let's worry about fall. All we see are numbers going up, and it's the middle of summer. It's supposed to be the time that things are like most accommodating to shutting down the spread. I don't know if this is something that has been talked about a lot at Navajo, but is that something that people are starting to stress, because winter comes and suddenly everyone's inside, and it's just really hard to contain the spread at that point?
When we're worried about the second wave, that's what's been stressed to us, is we don't want a second wave, and if we do, we don't want it to be as bad as it has been the first go around, especially with what's going on with surrounding cities and states. Our leaders are saying, when I say our leaders, mostly I'm talking about President Nez, he's saying that what he's worried about is if we have another go of what we had just recently, we don't know if neighboring hospitals can take us in, because they themselves are going through their own, I don't know if this will be considered a second wave, but they're going through a number surge as well. And he's just worried that, if we have more patients, we're at a capacity where we can take in patients in our 12 health facilities now. But if it gets worse, we don't know if anyone will be able to take us in. And we saw our peak in April when we were supposed to have it in May. So we hope we can keep it at this level and continue to decrease in cases.
Are there ICUs at Navajo?
Yes.
Okay.
I don't know exactly how many, but yeah.
Okay. I wasn't sure if the clinics had and the facilities had those, but that's good to hear. I know that another outbreak that Nate has been focusing on is at a residential home for veterans. Can you tell us, Nate, what's the latest there?
Yeah, I was actually on the phone with a family just before we started this. It's the William E. Christopherson Veterans Home in Salt Lake City, which is on the same campus as the VA Medical Center. And now it's 12 veterans who have died there. And out of about, I think they had 71 total, there were 71 veterans at the home, 50 some odd, I think, tested positive, and now 12 have died. And this has happened at some other nursing homes and residential care centers across Utah. We've lost 10 and 11 people at a time at some of these homes. And it basically works that, one worker is asymptomatic, comes in and winds up infecting one or more people at the home, and it spreads across there. Of course, these are kind of closed quarters facilities. Folks don't get out much. The staff have to work pretty closely with the residents to give them care, and that's the way it spreads. And the State Department of Health has recognized this and tried to do a couple of things to reduce the outbreaks. First and foremost, of course, they're working with them beforehand on hygiene and trying to make sure they have what's necessary to not let anyone get infected or spread in the first place. But then also, if they do have a positive case, the state health department will roll out with this kind of emergency response team with a bunch of testing kits, and they'll test every resident and employee at the facility, figure out who's positive, and start isolating people as quickly as they can before it spreads to more people in the facility. The veterans home is also an example where the entire facility became basically a COVID-19 facility. They didn't let any of the residents leave. They didn't take any new patients, and then they just kind of separated them. The people who were positive in one wing, the people who were negative in another, and then make sure they don't mix.
Yeah. We have a question from Steve on Facebook. What's the latest on Test Utah? Are they still offering COVID tests? Yes, they are. I can tell you that the state renewed its contract with Nomi Health, which runs Test Utah. Nomi Health is a health software company, and they renewed the contract until mid-July, and they say that they are continuing to do their test processing at Timpanogos Regional Hospital in Orem. That is the hospital lab that came under scrutiny by federal regulators last month as a result of some complaint or another. They did an unannounced inspection there, and they wrote up, I think, about 20, maybe a little more than 20 violations that they identified, ranging from stuff to not having certain protocols written down to not keeping samples at the right temperature in some cases, and some irregular results that weren't, I guess, addressed up the chain of command. So that's kind of what we know about the situation there. The hospital has said that owns that lab, has characterized the inspection and the violations as generally routine, and the state is continuing to, or at least as of I think the week before last, was continuing to send some of its overflow testing to that lab for processing. Now the state had an exceptional number of tests to process at that point, because that's when things were kind of going nuts up at the meatpacking plant. And so they were kind of getting a lot more requests for tests. But in the meantime, the state has put out a request for proposals, an RFP, for other bidders. So the Test Utah contract was awarded as a no bid contract. And now they are seeking, other vendors to provide proposals. But they said that they submitted the RFP too late to do that process before needing to renew the contract for another month and a half or 2 months. So that's the status of Test Utah. And it looks like we've got another question from Tullivan on Facebook. Can mayors enforce mask wearing if the governor won't issue a mandate? Nate, I see you reacting there, so go ahead.
We were talking about this morning, that the legislature recently passed a law that says the mayors can't issue restrictions anymore to severe than what the governor can impose. So it sounds like the answer to that is no. The best the mayors can do at this point is lobby. And you saw Salt Lake City Mayor Erin Mendenhall and Salt Lake County Mayor Jenny Wilson do that this morning on Twitter, basically lobbying for a mask mandate of some kind, which brings us to a point we made earlier. This is basically Gary Herbert's ballgame at this point. If he wants to impose more restrictions or take Utah to orange or even red again, he can do that, but it's going to be up to him.
Okay, well, and I'm seeing that that's the half hour, so I think we're good. I mean,
okay, thank you so much for inviting me.
Oh, Arlyssa, thank you so much. It's been great to hear about what's happening at Navajo Nation, and just, you know, it's just such a contrast, like the community reaction to some of these measures there as opposed to here. And I just think that it provides an interesting relief, especially because numbers there are going down, which is not what we're seeing in most communities in the rest of the state. So Nate, any last words to offer our viewers?
Well, I was just going to ask Arlyssa, I was told, I read early on there was a concern that literature or information wasn't being translated to Navajo, perhaps correctly. Is that right? Has that been fixed? Is everyone getting the information at this point?
Well, I really haven't heard much of that. The only thing that I've heard some talk about is the Navajo word for COVID-19, and I can't pronounce it correctly right now unless I see it. Okay. So because they think that the Navajo translation of COVID is not effective enough for elders to say, oh, okay, well, this is really serious. Better be careful. People are saying that, you know, fluent speakers, Navajo speakers, and if that may be, I don't know. So yeah, that's the only thing that I've heard.
Okay.
Yeah.
Right. Well, thank you both.
Well, thank you very much, you guys, and to our viewers who are there. So hopefully everybody can stay healthy.
Yep. Be careful out there.
Thank you.
Okay. Bye.
Bye.